next speaker is Dr. Anurag MISHRA.
Thank you, ma'am, and good afternoon, ladies and gentlemen, yet another time. I'll just extend the points that Dr. Nanda has already made. We have different IOL calculation formulae available to us in the form of the preloaded things that they have on the biometry. I'll tell you how do I coalesce all of them in my practice to give me the most optimal result that I look for. The first formula obviously is the Barrett's IOL calculation formula, and all of us use that. These are the whole gamut of Barrett's formula that are available to us. The last of which has been highlighted. It's called the TAL, or the True Axial Length Formula, which Dr. Barrett has modified. It's based on findings of differential axial lengths or differential thicknesses of the cornea, aqueous, lens, and the vitreous, because each of these tissues have a different refractive index. And when light passes through, there's only one machine which does that. It takes into account the speed of light traveling through these tissues differentially and then stitches them up to give us the total axial length. This is available for use only with the Argos at the moment, unfortunately, but I'm sure it will come in other machines as well. Now, since we were discussing about the posterior corneal astigmatism, the Barrett's formula is so robust in its algorithm that some of the biometers do have a tomography and they do measure the posterior cornea. But even if you're not measuring the posterior cornea, the algorithm is so solid that even with a predicted posterior corneal astigmatism, it gives us a fairly good result in most of our cases. However, not everything is perfect in this world, and so is the Barrett's. The fallacy of the Barrett is the Barrett will fail to calculate the IOL power. Mark my words, it will fail to calculate the IOL power if the lens thickness is below 2 and above 0, which means if you want to exchange an IOL, if you have landed up in a refractive surprise and you want to exchange the IOL, the Barrett's is not going to give you an IOL power. Okay, there you have to rely on the age-old Holiday calculator, because that's the next best thing that had happened to us before the Barrett's came in. Apart from the lens exchange and even the piggyback IOLs, where the Holiday is the only formula which will give you an IOL bar, the other thing the Holiday does is this. This right-hand side of the page is called the Holiday IOL Consultant software, wherein it gives you in that green banner, it gives you the exact expected refractive outcome at the spectacle plane post-IOL implant. So you know what is going to be the refractive correction the patient is going to need in the form of spectacles post-operatively, and you can modify that actually. It gives you, these are the segments which you can modify, for example, the incision size, the placement, flipped toric axis, all that. Takes time to explain all that, but this is what the Holiday has and no other formula has. Sometimes even the Holiday fails, and that's when I resort to the Keynes formula. The Keynes formula is something that interestingly has the K, AXL, ACD, LT, and PACI, and apart from all these, it also takes into account the biological sex of the patient. Keynes formula is a very good formula when it comes to keratoconus. So if you have a cone that is not progressing, that is a stationary cone, and you want to go ahead with the cataract surgery, the Keynes formula is the one that I choose. And the other thing where it comes in very handy is the extremes of axial lengths. In contrast to popular belief, the Hofer Q, which we had relied on for hyperopic eyes in particular, the Hofer Q does not at all perform optimally when it comes to the shorter eyes. The Keynes outshines it in its performance. And lastly, I'll come to something very interesting. This is a ray-traced formula called the Oculix. Now, the Oculix takes into account the pre-operative people. I'll show you something very interesting here. The IOL that has been chosen here is the Alcon. This is an Alcon multi-piece IOL. Okay. Now look at the pupillary sizes. These are the pre-operative pupillary sizes. For a 2 millimeters pupil, the best focus comes at 0.171 millimeters. If the pupil size is 3, it extends to 3.389, and the pupil size is 4, it goes to 0.698. What it means is, if you have a preoperative pupil of 2 millimeters, and you compare that with the it comes in here. If you have a preoperative pupil of 2 millimeters vis-a-vis a pupil size of 5 millimeters, the IOL power that is calculated for these two patients will be different. The best focus will come with a 19.5 with the same IOL if the pupil size is 2, and if the pupil size is 5, it comes to an 18.5. Luckily, majority of our patients have a uniform pupillary diameter, and it doesn't go down to 2, doesn't go up to 5 uniformly. The other thing the Oculix gives you is the material of the IOL. Which material of the IOL is best suited for this particular patient, taking into consideration the pupillary size and the higher order aberrations that are there in the cornea. For example, in this particular patient, as you can see, the SN6ATT, which is the axis of IQ, has the best conglomeration of those black spots, vis-a-vis another patient wherein the clarion outshines it in its performance. Takes a little bit of time to get adjusted to know which material is the best for which patient, but with time your optometrist and you yourself as a consultant get adjusted to it too. So I feel that the ray traced formulae will hold a very, very important place in the future. So this is how my flowchart works. The Barrett's is always the master band of the orchestra. The cane I use for extremes of axial lens. The Holiday consultant software, particularly for planning torics, both in monofocals, trifocals, and EDOFs. And the Oculix, if I find a preoperative pupillary size abnormal and finer adjustment in terms of the material. Thank you so much for your attention.
Thank you, Dr. Anurag. One question, please.
Yeah.
So while the question is being asked, our next session is on Make Odisha Proud. From the roots of our heritage to the heights of global recognition, these stalwarts make Odisha beam with pride. The first speaker is Dr. Sujata Das.
So is Oculix software is available in all the biometers or
No,
in the
no.
Argos or
So
online?
At the moment, it's not available online. It's a licensable formula actually, so obviously it will not be free. At the moment, it's preloaded with the Anterion, but I don't know what the future beholds though, because it's a licensable thing. You have to pay to use it. So whether or not they'll open it to be used with payment or not, it's something we'll have to see. Can you just open the PowerPoint? Olsen is not a ray traced formula, sir. I don't think so. Olsen is, because you have to have an equipment which uses the ray tracing technology to be able to use these softwares, to be able to use this
One more question.
calculations.
Dr. Anurag, in spite of all so many formulae, do you still get refractive surprises, and how do you tackle them? Or rather, how do you prevent them?
If the patient chooses what we choose for the patient, then 99.5% of the time we will not land up in any surprise. Having said that, there are the ELP calculation, however complex it might be, we are trying to decipher it for decades now, but we have not been entirely successful. So to answer your question, if you keep the boundary to be 0.5, I do get surprises, but beyond 0.5, it's very, very rare. Nowadays, it's very